What is peripheral neuropathy? So, peripheral neuropathy is a well-known side effect of chemotherapy, and it is a type of damage that occurs to the long nerves in your arms and legs. This is the peripheral nerves, the long nerves in your arms and legs. So the nerves in your arms that control your fingers and hands, the nerves in your legs that run down and control the feet and the toes. And speaking personally, it's a very distressing side effect of chemotherapy. I should say it's not just a side effect of chemotherapy, it seems to also be a side effect of some molecular targeted therapy as well. And again, that's based on my experience and talking to other patients. I haven't really looked into listed side effects of molecular targeted therapy, mainly because when you look into the side effects of those drugs, there's just this huge list. So the side effect kind of manifests itself as it could be like tingling or pain in the limbs, numbness in the fingers, and numbness in the toes, pain and discomfort in the hands and feet. And one of the reasons that I found it very distressing is you can have this thing where you just drop things absolutely without warning. So you may get a sudden weakness in your grip and things will just jump out of your hand. And that's because like when we're holding something, we think it's kind of a passive action, that you pick something up and it's in your hand, it's being held by your hand, and it's somehow like a passive thing. But of course, it's not really a passive thing at all. It's a very active thing. Your muscles are working together in very sophisticated ways to grip things. I mean, we have like I think over half the bones in the body are in the hands and feet. They are incredibly sophisticated. And if you think about those long nerves, I mean, like the long nerves in your arm, they're going through a very narrow gaps in the joints at your wrist and elbow, and there's ligaments in those joints. There's there's a whole bunch of stuff. I mean, blood vessels, of course. It's not a lot of room in there. With this incredibly sophisticated system allowing us to do actions that we take for granted. And when you have cancer drugs, unfortunately, this sort of the cancer drugs inhibit and damage the normal processes of the body that we don't really think about. Often doctors and nurses will ask you about peripheral neuropathy in terms of like tingling or maybe loss of sensation. But in my experience and in the experience of many cancer patients I've talked to, there's a lot of pain there as well. You sort of get muscle pain from the neuropathy because, of course, our muscles are operated by the nerves. And this can be really bad, particularly in the mornings, particularly cold mornings. It might take quite a while to kind of loosen up a bit. So it's I feel a very unpleasant side effect of chemotherapy and of some molecular targeted therapy. It is a side effect that is poorly managed by the medical system. there are various things that are alleged to help. Doesn't seem to be a lot of good, robust evidence for what works, and what works for some people may not work for other people. That may be, well, one obvious reason for that is that we're on different combinations of cancer treatments. But another reason is that physiologically there's far more variation in humans than we think. So, yeah, just the metabolism of the drugs, how persistent the drugs are, and various things affect it. However, I have kind of found three things that do seem to help with peripheral neuropathy for quite a few people. Two of them I've done and got reasonable results, and one of them I've just heard about. So the one I've just heard about is maybe the most sophisticated thing, and it's using TENS. I think that stands for trans epidermal neurostimulation, something like that. So commonly called a TENS machine or TENS machine. So this is like a device that stimulates the nerves via the skin, an electrical device, and it's the kind of thing you see in the like mail order catalogs and things, for people that suffer from kind of chronic disease where they've got nerve pain, aches, that kind of thing. I've heard some people get good results from this. I've seen some research. If you Google for scrambler therapy and the word chemotherapy, I think the research was possibly done at the Cleveland Clinic or maybe MSK. I'm not particularly familiar with American medical institutions, so they often get muddled up in my mind. But they did, one of those institutes did a small study, and got really remarkable results. I mean, 100% improvement. I think they were specifically looking at oxaliplatin, which is a Japanese chemotherapy drug used all around the world. It's one of those platinum-based poisons. It's particularly nasty. It's quite persistent in the body. It is one of the worst culprits for peripheral neuropathy. And then another couple of things I've tried and got some results from. One is ginger. Just taking ginger. Now, has to be kind of real ginger. So like some mashed up ginger in some food, or maybe I guess you can make herbal tea and stick some ginger in or something. It doesn't seem that like ginger extracts or whatever will work. Presumably that's because ginger's got a load of stuff in it and maybe only a few of the chemicals are active, or even maybe only one is active. And the reasoning is like allegedly ginger's good for inflammation, and I know it's been used for like people with joint pain and things. So maybe it's doing something to reduce the inflammation around the nerve tissue. I mean, nerves are encased in a myelin sheath, I believe, and get irritated. And in a kind of another one that I've tried, that's got very robust evidence for repairing nerve damage, but I've never seen any proper study specifically related to chemotherapy, and that's neural flossing. Neural flossing is it's a term that sounds, I don't know, it sets the alarm bells ringing, right? It sounds a little bit silly, a little bit kind of salesy, I guess. But neural flossing is just this like a type of exercise where you move a nerve through a joint, or through a tunnel in a joint, and this, at least for physical damage, There's reasonable evidence that this does help. It stimulates the repair of the nervous tissue. I think the most famous example of neuroflossing, neuroflossing, I should have looked up which it is, would be for your arms. And if you Google sports physiotherapy, neural flossing, I think, you'll find lots of kind of YouTube videos of physiotherapists doing these odd movements. Typically, you'll stretch out your arm, you will tilt your head in the opposite direction, and then you will maybe flex your hand. So in the case of like the ulnar nerve, which is one of those main nerves going through your arm, passes through the cubital tunnel in your elbow, and it's the one that it's on the surface at your elbow actually. So when it gets like hit, you know about it. You get that dead arm or tingly arm. So it's kind of often damaged in various sports, and also if you have elbow trouble, that may cause some trouble with that nerve as well. I mean, particularly at the elbow, cubital tunnel syndrome, and you feel that kind of the ulnar nerve controls like this part of your hand and these two fingers. So you might get some like numbness here, and ulnar flossing does seem to speed up the recovery process. It seemed to help me with peripheral neuropathy. Obviously, a big problem is that if you're a late stage patient, you may be on chemo for life. So you may do things that kind of help, and then the next chemo cycle begins and you're doing more damage. So peripheral neuropathy is damage to the long nerves in your arms and legs. And three things that potentially may help you are TENS, transepidermal, neural stimulation, ginger, and neural flossing, which is flexing your arms and legs in a way that makes the nerves kind of stretch a bit and particularly slide past other tissues and structures in the body, and that seems to stimulate some repair. So if you have like external damage to the nerve because you've been hit or you broke your elbow or whatever, you get this repair called Wallian regeneration, and neural flossing seems to help that. In the case of chemotherapy damage, the damage is quite different to like external damage, but seems to be neural flossing helps a bit. So hope that was useful, helpful, interesting, or whatever. Please make sure you hit subscribe. Make sure you click on the little bell. That helps because you get the videos and because YouTube will show them to more people, whatever. Okay, thanks a lot.